Namaste. Myself Dr.Nalina, Assistant Professor, Department of Kayachikitsa, Government Ayurveda Medical College, Bengaluru. So the purpose of doing this video is we are celebrating National Ayurveda Day. That is, the Department of Ayush every year on the day of Dhanvantari Jayanti, it is celebrated as National Ayurveda Day to bring awareness among the society regarding Ayurveda. So it is celebrated every year with some goals. So this year goal is Har Din Har Ghar Ayurveda. That is, so to reach Ayurveda to every household. And to specifically talk about the topic, that is this specific month, that is October, is celebrated across the globe as Mental Health Awareness Month. Specifically, October 10th is marked as International Mental Health Day. In that context, today I will be giving some information regarding the mind, how it is seen in Ayurveda. So, when we see the whole concept, the complete concept of health, so as it is defined by WHO, it is taken the regards of all the aspects, that is physical, mental and social well-being. So that means it is not only the physical aspect that is taken into account for the complete health, but also, mental, also social well-being. So in Ayurveda, likewise, Sama Dosha, Sama Agni, Sama Dhatu, Sama Kriya, along with that Prasanna Atma Indriya and Swasthya Manas. So all these aspects are taken to judge the complete health status of an individual. So about the awareness of physical health. So people are more aware. Blessing in disguise is the COVID-19, because of which the people have been more aware of how to take care of their health. So in that context also, mind plays a very important role to maintain that status of health. In the sense, so the body and mind are not the two separate entities. So each influences both are complemented to each other to maintain a status of health. Like for example, many psychiatric illnesses will be seen as some of the somatic problems, that is bodily problems, and some of the somatic problems, like for example, autoimmune disorders, psoriasis, etc. So which also known to exaggerate if the mental health is not proper. So that is why the mind and body are not seen as a separate entity in the aspect of health, but a single entity. That is why in Ayurveda we say it as a holistic approach. Whenever we are treating a person, it is not we are concentrating only on the body of the person, but also both the things. So if I had to speak of how mental problems are created, for example, in a sense, so the manas, so which is regarded as one of the indriyas. So also, the usage of the indriyas, so it has to be proper. In a sense, in Ayurveda, Atyoga, Mithya Yoga and Ayoga of the any indriyas will lead to many disorders. Like for example, so one of the indriya is Chakshurendriya, which is eyes. So Atyoga, that is excessively watching something or not using it properly, will lead to many disorders. Likewise, the usage of manas. Manas, the main aspect is thinking, right? So if we overthink, or there are some things which needs to be taken lightly, but if you are not taking like that, so all these things will act as very initial factors for manifestation of many mental problems. So it is important that we understand and identify what all the proper functioning of the mental status is. So in that context, I am going to tell what are the few warning signs that we have to identify in a person, so that whatever help is needed, we can assure that person. Also, if it is some kind of serious help that they need, we can also take into the proper channel. So like warning signs, like if a person is experiencing frequent mood changes, if it is prolonged mood changes is there is loss of sleep, and there are different eating disorders, like if a person is known to eat properly previously and now he has started fasting, the reason may be anything, but the change in the behavior such signs in a person, do not stigmatize. So stigma is one of the main thing that is attached with the psychiatric illness. So people have no problem in identifying any kind of physical problems, and they approach the hospitals and they take treatment what is necessary. But when it comes to the mental health, this is the main challenge. So whenever you come across such person, don't stigmatize, try to help and support them if possible, and take them to proper channel like many psychiatric or in the sense for treatment. So when coming to Ayurveda, we have a different approach for treatment. Like there are main three aspects: Sattva Vajaya Chikitsa, Yukta Vipashya, and Daiva Vipashya Chikitsa. Daiva Vipashya mainly relates with the different religious practices, and Sattva Vajaya Chikitsa. Sattva here meaning the mind. So whatever the things that will elevate the mental strength is taken as Sattva Vajaya Chikitsa, and Yukta Vipashya is essentially what is done in the hospital setup. So the treatment aspect, so which will be given for the mental disorders, will be explained by intern doctors. Thank you for listening.
So the Nasha procedure, according to Ayurveda, it is said that Aushadam Aushada Siddha Sneham Nasikabhyam Diyate iti Nasha, which means the administration of the nasal drops, administration of the medicated nasal drops through the nasal route is called as the Nasha. And it is also said that the nasa, that is the nose, being the gateway of the brain, and it is said that the indication of the nasha is mainly given in the Urva Jatragata rogas, which means the diseases above the clavicle regions. So now we will try to understand the indication of the nasha. So the indication of the nasha is mainly given in the mental health disorders, like it is given in the Apasmara, like the convulsive disorder, Unmada, like the psychosis disorders, and Atatvabhinivesha, the which means that is the lack of the coordination between the Di, Dhruti and the Smriti, and even given in the Chittodvega, which means the anxiety disorders. And it is also indicated in the Urdhva Jatragata rogas. The Urdhva Jatragata rogas are like, that is the nasal discharge, headache, and it is given in the migraine, and it is also given in the stiffness of the neck and other disorders. It is also indicated as an emergency treatment like the conditions like unconsciousness. So now we will try to understand the one of the important thing, that is the contraindication of the nasha. So contraindication of the nasha is the condition where the patient is suffering from the fever, or the person who consumes the alcohol, it is said to be the contraindicated, and it is also contraindicated in the rainy season and the cloudy days, and it is also contraindicated in the just after taking the heavy meals and just after taking the heavy liquids. There should be minimum 30 minutes gap before and after the nasha procedure. So now we will try to understand the procedure of the nasha. So the procedure of the nasha mainly concentrating on the Pratimarsha nasha. So the Pratimarsha nasha is a one type of the nasha where one can do it regular basis in the houses on themselves without having any contraindications or any side effects in it. So the procedure has mainly the three steps, that is the first step is a Snehanam, second step is a Swedanam, and the third step is the installation of the nasal drops. The first step called as a Snehanam, which means the application of the oil massage over the face. So the oil used for the facial massage can be different according to the different conditions. So this massage has to be done for 2 to 5 minutes. And the second step, which is the Svedana, which is called as a hot fermentation. So in the hot fermentation, one just merely has to take the steam for 2 to 5 minutes. And the third step is the installation of the nasal drops. So the nasal drops used are different according to the different conditions. So the two nasal drops has to be put into both the nozzles, one after the other. So this is the three steps involved in the procedure of the nasha. So on practicing daily basis in the house, starting it may feel difficult and irritated, but on getting the benefits of this procedure, you feel smooth and ongoing or practicing this procedure. So that's it about the nasha, and for getting the correct benefit and getting the correct procedure of the nasha, one has to consult the nearby Ayurvedic Vedio. Thank you.
Namaste, I am Dr. Nalina.A.S from Government Ayurveda Medical College, Bengaluru. Have you ever noticed that in the present era, most of us are suffering from anxiety, stress-related disorder, mood swings, diabetes, hypertension and other diseases? We are stressed from our day-to-day activities. Ayurveda is here to rescue you. There are many procedures which can help us for solving this issue, but Shirodhara is one of the best procedure among all the procedures. In Shirodhara, we need a Dhara table and we need a Dhara Patra. The patient is made to lie on the table and the head is covered with a ribbon, and the medicated liquid is poured from the Dhara Yantra into the forehead and make sure that the liquid doesn't fall over the eyes. The Drava Dravya which is used for this procedure is Kshira, Ghruta, Taila and the Vatha Churna. This procedure lasts for 30 minutes, after which the patient can take a break for 15 minutes and then he can wipe his head with it. For this, the Drava Dravya, the Taila which we use is the Kshira Bala Taila, Dhanvantri Taila and the Chandanadi Taila. The Taila Dhara mainly helps the patient with psoriasis. The Takra Dhara, here the Takra is mixed with the Amlaki and the Musta Churna, and it helps in reducing the anxiety and stress related disorder. Here the Takra is poured in the forehead and it activates the Agnya Chakra. As the Agnya Chakra is activated, the stress related hormones which are there, they get decreased, and hence it also helps in decreasing the blood pressure of the body. Next comes the Jaladhara. In the Jaladhara, mainly Narikela oil Jala is used and it is poured on the head of the patient. It decreases the migraine and the headache related issues. Dhrutadhara. Dhrutadhara is mainly given in the Pitta disease condition where the patient has burning sensation over the head, the Akshiroga, the Karna Roga. It also improves the vision. Shirodhara not only improves the vision and it not only removes the toxins from the body, at the same time it provides calmness, tranquility and meditation kind of situation to the patient. This procedure should be done under the guidance of an Ayurvedic physician only. Thank you.
I am Divya, intern Government Ayurvedic Medical College, Bengaluru. I am here to share with you about the topic impact of Ahara and Vihara on the mental health. Ahara means Agiriyate iti Ahara, Annapanadi Sarvada, which means the materials that has to be taken inside the body. Diet is a kind of basis for the life, strength, complexion, ojas, growth and development, as well as perspicuity of sense organs as well as happiness, etc. The classification of Ahara, it is from single classification to the innumerable, but based on quality and on rasa, by the permutation and combination we have so many types of Ahara. Basically, based on the manasika vikaras, there are three types of classification of Ahara, that is Sattvika, Rajasika and Tamasika Ahara. And food which is taken inside our body will be divided into three types, that is Stula, Madhyama and Anubhava. Here the Sukshma, that is the minute part of the Ahara, will help in nourishment of the manas. Diet is a kind of dietary and the lifestyle practices that an individual habitually chooses to follow has an impact on the mind or the mental health. Mental health is the social, economical and the psychological well-being. Impact of Sattvika Ahara on the mental health. Sattvika Ahara is the type of food material having the properties such as the Snigdha, Sthira, Rudya and has the benefits such as Ayu, Bala, Preeti and Sukhakara. It is the sort of diet which increases the Sattva Guna in the body. Such diet will orientates the mind and promotes the greater sense of sympathy and compassion. The food materials such as fruits, milk, ghee and sesame, honey and drugs such as brahmi, amla, shatavari, etc. will be under the Sattvika Ahara. Coming to the impact of Tamasika as well as Rajasika Ahara on the mental health. Rajasika Ahara, impact of Rajasika Ahara on the mental health. Rajasika Ahara will induces the activity and the agility. The Rajasika Ahara food materials such as spices, tea, coffee, chili, pepper, etc., which will on excessive consumption causes the hyperacidity, hypertension, etc. disorders. Then coming to the Tamasika Ahara. Tamasika Ahara is the sort of Ahara which induces the inertia and the inactivity, and as well as it increases the kapha in our body. Food materials such as overcooked or the burnt food items, cigarette, tobacco, alcohol has the properties of Tamasika Ahara. Hence, both on excessive consumption will induces the diseases and has the impact on physical as well as mental health. Thus, it is better to consume the Satvika Ahara in our day-to-day. Coming to the Vihara is nothing but the lifestyle, means day-to-day life regimen. In our science, it is mentioned that the day-to-day activities has to be followed, like the daily regimen, Dinacharya, seasonal variations, Ritucharya, night regimen, Ratricharya, Sadvrita and the Achara Rasa Paripurna. Other than these, we have exercises, pranayama, yoga and the proper sleep and its impact on the mental health. Exercise and the brain. Exercise has the impact on brain both directly and indirectly. Directly, it improves stimulation of the growth factors and it reduces the inflammation as well as have the ability to reduce the insulin resistance. Indirectly, it will improve the mood and sleep and thereby it reduces the anxiety and the stress. Coming to the yoga. Yoga, different asanas will help in improving the patience of the person's physical flexibility, coordination and the strength. Lastly, the pranayama. Pranayama will help in reducing the anxiety. So, all these will help in reducing the mental sort of disorders, thereby helps in achieving the higher quality of life. Thank you.
Namaste, I am Dr. Kaveri, internee from Government Ayurvedic Medical College, Bengaluru. Today I am here to speak about Achara Rasayana. Ayurveda has contributed a great and unique concept of Achara Rasayana. It's about the codes of conduct, how a person should live and what he should do and what not to do. It is an integral part of preventive medicine. Achara Rasayana aims to provide good mental, physical, spiritual health and general well-being. We all know that most of the persons suffer with the stress, and main cause for the stress might be our behavior towards persons or the things. Ayurveda equally considers all the aspects of life for optimum health. These includes consideration of the physiological, psychological, spiritual, food and diet aspects of the life. Achara Rasayana includes all these aspects. Now I am going to give a brief about all these aspects one by one. First, coming to the psychological aspects of the Achara Rasayana. It includes Satyavadi, to be truthful, and Priyavadi, not to clash with each other, and Ahimsa, avoid violence, and Anayasa, to avoid exhaustion and to avoid excessive anger, and Priyavadinam and Prashantam, to be calm at every place. And now coming to the social and behavioral aspects of the Achara Rasayana. It includes Deva Go Brahmana Acharya Guru Ruddharchane Ratam. One should respect elders, Deva, Go and Acharya, etc. And Nivrittam Madhya Maitranat. One should avoid excessive alcohol and observe celibacy. And Adhyatma Pravanendriyam. One should have a faith in the Almighty and one should have control over the sense organs. Now coming to the spiritual aspects of the Achara Rasayana. It includes Dharma Shastra Param Nityam. One should follow righteousness and one should have a knowledge about the spiritual books and one should read the spiritual books regularly. And Tapasvanam, one should do a meditation regularly. Now coming to the personal aspects of Achara Rasayana. It includes Shaucha Param. One should follow proper hygiene and Samajagara Swapnamcha. One should have a balanced sleep. Now coming to the food and nutritional aspects of the Achara Rasayana. It includes Nityam Kshira Grutashina. That is, one should have a proper quantity of kshira, that is milk or the gruta or the ghee as according to their digestive capacity. And one should not consume sankirna ahara, that is asankirna, that is to maintain a balanced diet. So, following these codes of conduct can help to reduce the psychosomatic disorders and strengthens the mind and relieves the stress. Thank you.